This is Dr. Eboni. That is Dr. Eboni, not Y. I am here to talk to you today to give you my scoop on jaundice and to discuss why this is an important issue for Beyonce, Jay-Z, their newborn twins, as well as the parents of other newborns. I am board certified in both general pediatrics as well as developmental and behavioral pediatrics. So because of that, this is important in terms of newborns as well as older children who may have developmental and behavioral challenges later in life. I am right here in Beyonce's hometown of Houston, Texas. So I want to talk to you a little bit about jaundice. And jaundice is the yellowish discoloration of the skin and the eyes that we can see in newborns. It is present in almost all of newborns, but we can only see it from the outside in about 2/3 of newborns. It's very, very common, and most of the time it doesn't cause any harm or any problems for the babies. And so basically, bilirubin is the substance in our bodies that are released with the breakdown of red blood cells. And typically that is taken out of our body after it's broken down by our livers. So having high bilirubin levels or jaundice in new babies is so common because their livers aren't yet mature. They are not yet able to quickly and efficiently break down those substances to excrete them from our bodies. So there are some babies that are more likely to have jaundice than others, and those include babies born prematurely or a little bit early, babies who have excessive bruising from the birthing process, babies who have an incompatible blood type from their mothers, as well as some babies of Asian descent. So those are some of the babies that this happens more frequently in. And so prematurity and jaundice are probably parts of the reasons why Beyonce and Jay-Z's twins are still in the hospital. It's been reported to us that they are under the lights. And so that very likely refers to phototherapy, which is by far the most common treatment of high bilirubin levels or jaundice. And so kind of what that looks like, it's blue lights that shine down onto the baby. Usually the baby is in an isolette or a glass box looking thing. And those lights are absorbed into the bilirubin to change it into a form that's easily or more easily excreted from the baby's body. And so phototherapy is generally considered very safe and to have minimal side effects. Some of the medical side effects include drying of the skin. Babies can get rashes on their skin. They can have loose stools. But those are all generally temporary side effects and not long-term side effects, which is a good thing. Now, as a developmentalist, I think about kind of the developmental implications for treatment, not just the medical implications. So from a developmental standpoint, whenever babies need treatment of any kind outside of just standard newborn care, diaper changes, feedings, and so forth, it often can require that the parents be separated from their babies for however long they need this extra treatment. And especially for bilirubin and the phototherapy or the Billy lights, the babies often are in these isolates, these glass boxes, and that causes separation between parents and their babies. And so those first hours, first days, first weeks of life are so important to establish parent-baby bonding. And often we do that in new babies with skin-to-skin contact, where the babies can lay on the chest of the mom or the dad and really start to facilitate the development of a first and important relationship. And so, we don't have to just think about the medical implications, but also the well-being of the social and emotional development of the baby and the relationship between the parents and the baby. So that being said, why should Beyonce, Jay-Z, and other parents of newborns think about or be concerned about jaundice? So we as healthcare providers are closely monitoring bilirubin levels in order to make sure they don't get too high. When they get too high, that can cause other complications, and that's what we're trying to avoid. When bilirubin levels become excessively high, that's known as a condition called kernicterus, which is also known as bilirubin encephalopathy. Now, isn't that a $20 word? But all it means is that the bilirubin has gotten so high in the body, baby isn't able to get it out of the body quickly or efficiently enough, and then it can accumulate and cause damage to other parts of the body. And so that's the reason for the phototherapy, is to try to get that bilirubin out to avoid this. Early on, when baby's bilirubin levels may be too high, that may look like excessive sleepiness. The babies may not eat as well. They may be very, very fussy. And so those are some of the things to look out for. More long term, if the high bilirubin levels are not treated appropriately, that can lead to more chronic conditions. It can lead to brain damage. It can lead to cerebral palsy, hearing and vision impairments. And so that's why we really have to stay on top of it and make sure that we treat this appropriately, treat it quickly, and keep a good eye on it. So for healthy long-term development of the babies, proper treatment is crucial to avoid these potential developmental complications. The good news, though, is that kernicterus, or excessively high bilirubin levels, is extremely rare, which is a good thing. And it definitely sounds like Beyonce and Jay-Z's twins are getting the care that they need. So Beyonce, Jay-Z, and the parents of other newborns, as well as the medical professionals who care for them, should be on the lookout for high bilirubin levels to reduce the risk of neurologic complications, including brain damage, hearing and vision problems, and other things as well. So thank you so much for watching. We are definitely wishing Beyonce, Jay-Z, their twins, the very best. So I hope that this information has been helpful. This is Dr. Eboni, and so let's keep taking good care of those babies. Thank you. Bye-bye.